Is it this camera or this camera? Is it this camera or this?
There's both cameras.
So which one do we look at? I don't know Cosmetic.
We'll ask him. Okay, are we live? All right, welcome everybody. I am Dr. Filiberto Rodriguez for RGV Cosmetic Surgery and Vein Care for another Facebook Live event, and we want these events to be very educational. I'm fortunate to be accompanied by some of my nurses. This is Miss Laura. She's our nurse injector, and this is Dulce. She's one of our new OR nurses who comes to us with 7 years of experience in the ER. And we're going to be talking with them about safety and cosmetic surgery and what some of their experiences have been in the ER and also as a patient themselves, unfortunately, with other underqualified surgeons. Want to say one thing. In the Facebook event, there is a link to a survey that our PR team has put together. That's a really important information. If you would please take the time to do that survey, it would really help us a lot. Get information from our patients about their concepts and ideas regarding cosmetic surgery and safety. And in addition, we have done these Facebook Live events in the past, and unfortunately, a lot of people just call in with questions about pricing. And this is not the venue for that. And one of the reasons we can't really talk about pricing in this kind of a venue or even on the phone when they call our front desk is because we have to see the patient to really understand what they need. You know, for example, these are two very beautiful women but have very different figures and shapes, and we can't compare apples and oranges, and that's why we can't give quotes over the phone and via these kind of events. So we ask that you really understand that. So I wanted to start off with some exciting news in the clinic. Before we get into our discussion with our moderator, we have an off-screen moderator as well. Some really exciting things that we're doing here in the clinic. Number one, we are one of the only centers in the country that does what's known as rib cage modification surgery for waist remodeling. And people call it rib removal. It's just segments of the ribs that are themselves removed, and we can do it as part of a tummy tuck, and it really transforms a woman's figure, or even a man's figure if he wants, but basically from a squared waist to a nice hourglass-shaped waist. So that's something exciting, and my team will be posting some of that on our social media and other venues. And then the other exciting thing we want to talk about, and it's something that Laura works with, is we have a whole new set of body tightening devices that work not just for the body. It's called the Evolve system, and then also there's Morpheus for the body, which really trims and tightens. And then we have one for the face, and that one's called Evoke, and they'll be posting this on social media, but we are one of the only triple certified centers to have all of these technologies. Some of them need to be done under anesthesia because to get a really good result, but a lot of them can be done on the clinic side and are relatively painless, like the Evoke to tighten up the cheeks and the chin.
15 minutes.
It's how much?
15 minutes.
Yeah, 15 minutes per session, so 30 minutes total if you want to do your chin and your neck and your cheeks. So we just wanted to talk about that, get that information out there, that this is new, exciting, non-invasive technology. Obviously, they have to be the right patients, right? I mean, if they need surgery, they need surgery.
Right.
But there are some patients who are perfect. Just have a little bit of loose skin, maybe some stretch marks here, and they're perfect for these kind of technologies. And so we will work with you when you come in to decide if it's right for these technologies. So without further ado, let me start off by talking with this Ms. Dulce. So you worked in an ER for about 7 years, right?
That's correct.
Yeah. And you've been here with us for coming about 1 month, right?
Yes.
And one thing that you noticed that you said to me in the middle of one of our surgeries, we were like, I didn't realize how complicated cosmetic surgery was.
Yes.
Right?
I really just thought that you would come up here and show Doc a picture. This is what I want to look like, and this is what you would get. But it really does have a lot comes into play when you want to get good results. And I think that's one of the biggest shocks that when I came to work here, a difference.
So you're coming on board because one of our senior nurses is retiring. So in the OR, you know, it's not just me.
Oh, no.
And it's not just me operating with a secretary assisting me, right? So I have you circulating in the room, a nurse who actually could get a job in the hospital as a nurse. And then I have my first assistant, right, David.
Yes.
And then I have my other surgical assistant. And then we have our anesthesia provider taking care of the patient. So there's 5 people in the OR working for one surgical patient.
That's right.
And I can tell you, my anesthesia provider has definitely made me aware that that's not how it is at other places. And you end up with an underqualified surgeon operating with a secretary assisting him, and then end up with a horrible experience like Ms. Laura had. And she'll talk about that with us a little bit later. What else, Ms. Dulce? Anything else that you want to share with the
It's
people?
not, unfortunately, it's not uncommon to see patients go into the emergency room after having surgeries infected with bowel perforations, having to have them rushed to the OR, to get that fixed.
That's really important what she just said. I don't know if you heard her. People trying to get liposuction done or surgeries done in Mexico or with other underqualified surgeons, even here in the area, bowel perforation. That's what she said. So that's where the liposuction cannula goes through the muscle into the abdomen and penetrates the intestine. And that's a surgical emergency. Like you said, you've seen people get rushed to the OR.
We have seen patients that are rushed to the OR that are septic, that have to get on drips, end up in the ICU after these surgeries.
And this, unfortunately, is the kind of stuff that people don't talk about. This is real. This happens pretty often in your ER, right?
Yes,
You
it's
see it
not
all the time.
uncommon to see that.
Yeah.
Like their poop is in their body.
Yeah, exactly. Now, granted, thankfully, it doesn't happen to me. I mean, we really think, it's because of our skill and we have safety, but cosmetic surgery is real surgery. And people put their lives on the line when they just go and oh, me voy a hacer un quick lipo. It doesn't really exist, and then you end up in the ER and you could be in the ICU and hopefully not die. And that happens a lot here in the Valley too, and people don't talk about it. There's a lot of deaths from cosmetic surgery. Anything else, Kelsey, you want to ask?
Yes, I wanted to ask how the safety factors into the overall cost when getting a cosmetic procedure.
How safety factors into the overall cost. And that's what you mentioned
Yes.
when you started with us. Well, we've touched on it a little bit. First of all, our operating rooms are certified, and we have a real anesthesia machine. And as we've discussed, we have a whole team taking care of the patient. So it's the nurse circulator, the anesthesia provider, the certified surgical assistant, and surgical tech, who both can actually get jobs in the hospital, plus myself. And a lot of people forget about that, and they try to compare me with other surgeons. And like I said earlier, we're one of the only centers in the country that does the ribcage modification surgery. I went to college at Princeton. I did medical school at the University of Virginia with a full scholarship. Then I did my surgical training at Stanford University. I did cardiac surgery training because I was going to come home and work with my dad before I switched into plastic surgery and ultimately cosmetic surgery. And that's a complicated story for another day, but that background of training in general surgery, cardiothoracic, and plastic and cosmetic is what allows me to do these complicated ribcage modifications and other big 8-9 hour surgeries that we do here safely. And that's really important. So that when people think about that, I think, Dulce, you imagined that anytime people were going to have cosmetic surgery, it was like my OR. You would think it would be...
I would think.
Huh?
I would think.
You would think, right? But unfortunately, that's not the case.
No.
And we'll talk a little bit more about your experience in a little bit.
So I think a lot of people think that, they see a picture on the magazine and they'll be like,
That's exactly
that's
what I thought.
exactly what I want to look like, make me look that way, but they don't factor in how are they going to get there, who's going to take care of them, are they going to wake up, are they going to feel pain, what is the aftercare, what is the pre, like all of those things, they don't realize that. So unfortunately, I think down here especially a lot, people go in and they're like, lift your shirt. Okay, yeah, it's gonna be about $3,000. You wanna do it next week? Let's do it next week. Okay. And they make it seem like it's not complicated, but then when they do have complications, it's like they don't realize they're diabetic. They don't realize, some people don't even do a medical history, labs.
Yes.
Oh, that's because, yeah, there's other doctors in town who aren't really trained as surgeons. So there's an expression, and I have a little 13-month little baby boy, and he's great and he's super smart, but he doesn't know what he doesn't know yet. Like, we have to protect him. He doesn't know that the hot stove is going to burn his hand. Well, sadly, when you have these other doctors trying to do cosmetic surgery, they don't know what they don't know. They haven't been trained. They don't have the experience. They don't know what to do when things go wrong. And these poor patients, like Laura says, oh, lift the pressure, yeah, that'll be $3,000. No, it's not just $3,000, but for them in their brain, they think that's a lot of money, and they're going to subject the poor woman to be tortured. They don't even do it under anesthesia most of the time, and that's what they're talking about. That's what, I mean, you guys are having a great conversation about.
Yeah, and then it's like, I don't look like her. What happened?
Yes.
And then it's like, now I got to go get it fixed. Now I'm not happy. I'm not comfortable anymore in my swimsuit. You know, there's all these things that I hear. So it's not after the fact. And then patients go in trusting that the professional is going to know what to do, and they know what they're doing because they're the doctor, they're the office, they're the clinic. And so you go in there trusting that, okay, so then I guess I can do it. But I think it takes a lot of admiration of a professional to be able to say, like, maybe you are not a candidate, or this is not right for you, and that's safety. That's safety, patient safety, provider safety, and I think that a lot of people do not take that into consideration. And I remember, I'm sorry, but like, we work in different departments, but I could see her running back and forth and like, oh my goodness, and like, it's very different because ER, and I think she says when ER, you're trying to save lives, so you're throwing stuff, you're this, you're that, and it's like, save the patient, bullet wounds or whatever. Here in this, it's like, everything is
so
orchestrated,
meticulous, yes.
everything needs to be perfect, everything needs to be clean, sanitized, sterile.
Exactly.
And there's literally people doing or trying to do some of the procedures that we do or you all do in a clinical setting, in an office where you go if you have a cough, and that's not
Sanitary.
That's not sanitary, that's not safe, and it's not worth saving a little bit of money, and I've gone through that, so I can be an advocate for patients out there that, you know, in this setting, in this field, in my opinion, you get what you pay for, basically.
Yeah, and that's an important concept. You know, you had asked me earlier, you know, Kelsey, about who is in the OR, what is safety. Well, you know, a surgical tech who has experience, and my surgical assistant actually used to do heart surgery working with my dad. That's Frankie, and he's phenomenal. He knows how to really navigate the OR, keep things sterile, which people don't appreciate, you know. A liposuction, you get a horrible infection, which is what you see in the ER, because that cannula is getting through your skin, under your skin, and just spreading bacteria all over your stomach and your back if it's not properly sterilized. So even the work of sterilizing the equipment,
Yes.
we have the same sterilizing equipment that Cornerstone Hospital has. And actually the same technician who works at Cornerstone Hospital comes here afterwards and cleans our surgical equipment. So we have hospital grade sterilization, which is important, which is why we don't tend to get infections. So this is important, and you know, Laura, maybe now's a good time to kind of talk a little bit about what you suffered. You know, I don't think you're not shy. You tell your own patients about your story.
I'm not shy now, but it's taken me some time. In the beginning, I think I was embarrassed.
So it was your old boss who was trying to learn how to do some surgery, who then took you with this gynecologist who pretended to know how to do breast augmentations.
Made it sound so easy.
Yeah, and I can tell you as a fact, he has no idea how to do breast augmentations, and much less yours were a much more complicated surgery because you were not only a breast augmentation, you also needed a lift.
Right.
And he didn't know how to do that, and I guess you suffered through 3 surgeries or something? I don't know.
Yeah, so I did, I thought it was gonna be a quick, easy, and I was naive, and that's why in the beginning I was embarrassed.
But that's also how he made it sound, right?
That's how I made it sound like, oh look, just go big or go home and let's put these implants in and you're gonna look great, we'll be done quick. And I didn't really ask too many questions either because I trusted, as within colleagues, that, you know, okay, maybe he knew what he was doing. But, you know, again, I was embarrassed because I thought he has to know what he's doing. He's a doctor. So I get him in, and as they're healing about 6 weeks later, they're not settling right. They're all over the place, look really unnatural. And he said, you know, I don't like how they're settling, so we need to probably do a lift. At first, he was gonna try to do it just like lido or something. He's like, maybe I don't need to put you under.
Oh, do it under local.
Local.
Yikes.
There we go. And I said, I don't know, is that safe? I don't want to hear. I'm very nervous about doing that. And he said, oh, guess what? I can fit you in this time. So 6 weeks later, I did a lift, and right away, you know, I think it's really important, especially nowadays, that we're just so rush. We don't listen to our bodies. So I felt something was wrong, but I didn't know better. I thought that was just part of the healing process until one day somebody told me, you spilled coffee on your scrub. And I said, but I didn't even have coffee. And I went and I was draining, and that's when I really kind of looked and saw that basically everything was opening up. So I sent him a picture, and he tells me, you need surgery again. So a couple weeks later, he rushed me in because he also thought that I was going to become septic because the infection.
So septic means infected?
Yeah.
Okay.
I had an infection. So I was raised where, you know, antibiotic was really the last solution. I think I had antibiotics once in my life. In between this whole process, I was on 3 different antibiotics orally. I would take antibiotics through the IV once a week, and I would do IM antibiotics twice a week. And I would go in twice a week for wound changes because everything was literally flesh open. And it was hard on my body, those 3 surgeries back to back, and it was hard on my body to try to heal and rebuild skin. And mentally, it was very, very emotional, and to look at yourself when you're wanting to better your image or have more self-confidence, and then to see yourself pretty much rotting away is not a good experience for anybody that I'd wish on anybody. So that's why I say it was embarrassing for me. Even intimacy, you know, all of those things you don't think about when you're wanting to do a cosmetic surgery, but that's why I can say now, like, you know, let me advocate and let me make these patients realize what they're really committing to. So yeah, I went through all of that, and 8 months later, my skin finally grew back, and I stayed with horrible scars, but I was still in a lot of pain, more pain than I had ever been, and mostly on my right side. I could barely even pull my arm back to even work, which is something that came up in a conversation when I first started working here.
Mm-hmm. Yeah, so you came on board and you really helped us rebuild the med spa. You and I have worked together, but then since then you've done a lot of more advanced training on your injections, and you're doing a phenomenal job. But yeah, so basically Laura came to me and we did a formal consult, and she showed me what she had done, and we cannot show you those pictures. They're just way too graphic, but if you can imagine the worst possible scarring and horrible looking implants for a breast aug breast lift, just picture that. And that's what poor Laura had and you heard how much she suffered. And we planned a really complicated revision surgery. Were you here with us yet for that, Dulce?
Yes.
For hers? Yeah. Mm-hmm. So we totally redid her surgery. Her implants were in totally the wrong pocket. They were flipped upside down. We were able to totally cut out her old scars, redo a beautiful lift on her, and put the right sized implants, because even the implants that they put in her were the wrong size.
Yeah.
So again, people don't understand how complicated, forget a simple breast augmentation, now add a breast augmentation with a breast lift and the associated scarring. Now, Laurel will show her breast to anyone and just look how invisible my scars are. You know, she's very confident. And she's an injector and she's a nurse, but it's, and you had no pain with my surgery.
I had no pain. The first day,
tight.
It was tight. And I said, oh, wow. The second day, I was like, this is amazing. Like, I feel sore, but this pain on this whole side of my shoulder was gone. I can sleep well because I remember telling Mary Jane, it's like, I don't get it. I turn to my left and I have this pain in my chest. I turn to my right and I have this pain here and I pain.
That was before.
That was before.
Yeah.
Now, it is like I can reach my arms up. I don't even have 3 weeks post-surgery. I work full time.
Yeah, you had your surgery on Wednesday and you were back to work the following Monday.
Yeah.
You just took off Thursday and Friday and the weekend just to rest.
And I'm not overdoing it. Don't get me wrong, but I feel great. I even feel like I just feel great all around. Besides the confidence, like how I feel my body looks better, it's healing better. And when people ask me, I'm like, do you want to see? Because let me show you what I look like before and what I look like now. And if I would have known that, I would have totally done it differently. And so now I'm not embarrassed to say how it happened. And I want to be an advocate for women and men that want to do cosmetic surgery. It's not just fun and games. It's really not. It is, you invest a lot, mentally, physically, and financially. So you want to make sure that you are choosing the right person. And I even hear horror stories when I'm doing injectables where they're like, oh, I walked into a place and they literally were like, oh, do you want to come in? I'm doing a surgery right now. She said it's okay. She's awake. And it was like, are you kidding?
No, it's not like that.
Yeah.
So and that's kind of why I wanted, that's perfect what you're talking about, because that's what Dulce also brings with her experience of dealing with these patients literally dying in front of her in the ER.
Mm-hmm. Yes.
And so I know you actually need to go to the ER, but any questions for Dulce?
No, that's all for now. Thank you, Dulce.
Thank you.
But I'd like to hear more about some of the botched surgeries that you've helped fix. But first, I'd also like to hear some red flags for people to watch out for when they're looking for a cosmetic surgeon, as well as what they should look for in a cosmetic surgeon.
That's a good question. Do you want to tackle the one about the red flags? You kind of went there about, oh, come on in, I'm doing a surgery.
Yeah,
you know?
I've had people tell me low lighting. They were like, it was so weird, like it was dark. I had a patient tell me like, don't they want to like really see me? I've had a patient tell me that they were bad-mouthing other providers. I don't believe in that. No, to specifically start spitting out names and stuff, that for me would give me a bad vibe. You don't have to push people down to bring yourself up. I've had people tell me that they were doing consults with their hand on the door handle, like, anything else? Do you need anything else? Like, they weren't giving that full one-on-one attention, and they were saying, like, I pay for your time, I still have questions. I've had people tell me that they would ask questions and they wouldn't get answers. I've had people tell me that they wouldn't listen to them. If they wanted a certain, it was like a cookie cutter. Like, all your patients look alike. Like, I don't want that. I was kind of, it's like, no, you don't want that. You want this. And so for me, those would be red flags, definitely, because none of that really happens here. And
yeah, I mean, there's a lot. You have a lot of people in town giving away free consultations.
yeah,
Really? Free consultation, and then you're supposed to pay for your surgery? That's kind of a red flag. Another thing is, I think if you're dealing with a really truly trained surgeon. For example, DHR, Doctors Hospital Renaissance, has brought on faculty 3 board-certified plastic surgeons. And I talk with them a lot, and their main goal is to do reconstructive surgery on the trauma patients that come in and the breast cancer patients. That's what they love it. They're publishing papers on it. They're not really into the cosmetic. Cosmetic is a different animal, and you're dealing with a perfectly healthy person, and you're trying to just make them a little better. Okay, whether that be with a breast reduction or with a breast implant or with a tummy tuck or with the rib cage remodeling, even though it's very serious surgery, your goals are different. So red flags, I think, are look at their before and after pictures. Just show me, where am I going to have my surgery? Who's going to be taking care of me while you're operating? Who's doing my anesthesia? A lot of cosmetic surgeons here in town, they don't work with actual anesthesiologists. They push their own drugs while they're operating at the same time, and if the patient hurts, they just tell them to squeeze the teddy bear a little harder. You know, and I like how Laura said it, we don't really need to badmouth people to build ourselves up. What people know and the misconception people have about us is, oh, they're so expensive. Not really. It's just that, like yesterday's patient, the ribcage modification, that was an 8-hour surgery. So if her friends hear, oh, she just got a tummy tuck and it cost that much, no, she didn't just get a tummy tuck. She got liposuction to her flanks, her back, her abdomen, inner thighs, fat transfer to the butt, and rib cage modification. So that's the misconception, is that people don't actually communicate what they had done. And so that's why everyone thinks it's so expensive. No, it's not. Laura's reconstructive surgery that I did on her breast was a 5.5-hour surgery. Take out the old implants, which, by the way, the surgeon that operated on her imported them illegally from Mexico. They're not available here in the US, the ones that we took out. So that right there tells you a lot, because the actual US FDA approved implants cost about $1,200. You know, so he knocked off, probably got them for free, probably just smuggling them in from Mexico. And she didn't. That might be one of the reasons why she was having pain, I don't know. But we had to put new implants under the muscle, redo her lift, excise her old scars. So it was a complicated breast surgery. It wasn't the same as Dulce, who was here earlier. We could do a simple 1-hour primary breast augmentation, but you're comparing apples and oranges. And that's what happens a lot with us. What about the butt?
Can you give maybe a short list of what to look for on paper for a cosmetic surgeon, since patients can't see behind the scenes?
That's true. Well, I think, first of all, it should be a red flag if you go to a surgeon's website and you can't find their resume. Like, if they're not proud to show you where they went to school, where they did their training, and what they're certified in, that's a pretty big red flag. I think, secondly, if you're not actually seeing the surgeon at your consultation and you just have a medical assistant who's pushing you into some surgery because they're going to get a commission if you book, that's a problem. Because during the consultation is when I get to meet the patient, look at their body, and really understand what they need and answer their questions. Another big red flag is when you have non-surgeons trying to do liposuction or body tight in their office, and you can tell right away that they don't know what they're doing.
After a 2-day course.
Correct. Because the companies, they don't care. They just want to sell these devices. I mean, these are $100,000 devices. So they'll sell it to any doctor, and then they'll say, oh, come train with Dr. Rodriguez for a weekend, and then you'll know how to do it. No. And they don't do it right, and the patients suffer, and they get burned, and they get mutilated, and this is serious stuff. I mean, Laura told her story very nicely. Basically, you felt mutilated, and you were ashamed of your body, and now you're like, oh my God, this is what I was supposed to feel like. I feel so, it's really sad when you see it.
Yeah, it was super sad. And then I can even go a little bit more personal, but going through a separation with my ex-husband, he would use that. He would say, like, nobody's gonna want somebody who's rotting inside. Nobody's gonna want a Frankenstein. Nobody's gonna want, and again, that was another self-esteem thing for me, because I felt already ugly. I was rotting inside, literally, and I didn't know where else to go or who to go to to try to fix it. And it was just like, what do I do now? So I'm so thankful for you and your staff. I felt so comfortable. And that's why I have the confidence now, not only because they look great, but to let people know that there is a solution. If you guys have been botched out there, don't feel embarrassed. Come in. I mean, it's definitely something worth fixing. And I feel like super, super confident, super happy. And I'm just like, I can finally breathe. I finally don't have pain, and I feel normal now. Honestly, I do. And it had been years since I could look at myself in the mirror. Even though I am so fresh out of surgery, I'm just like in love with them. Like I could stare at them all day.
Well, you settled really nice.
Settled really nice.
Yeah, you have.
So I'm so happy, and thank you so much, and thank you MJ and all the staff there. I was so happy, and when I came back to work, I was like thanking everybody. But yeah, there is hope out there. But really, social media is great. It gives us a chance to reach out to people, but it also gives people a misconception, and I don't know if naive is the correct word, but it makes it seem so easy. It makes what I do or what he does or what people do here so easy or look easy, but it's not. They feel like we're playing all day, but we're not. Serious complications can happen, and if you don't have the solution, that's where you get screwed.
And that you make a very good point. And serious complications can happen, even in my hands.
Yes.
I can have patients who don't take care of their surgery, and bad things happen to them, but at least I have the team, I have the surgical team to take care of my own problems. And that's important. And that, I think the biggest red flag you asked was basically if it sounds too good to be true and it's super cheap, you're gonna get into trouble. I mean, that's the bottom line. You know, anesthesia costs, but anesthesia is important so that I can safely do my surgeries and do all the work I need to do without having to worry about this poor patient who's suffering and feels everything I'm doing. So yeah, does the anesthesia add a little cost to the surgery? Sure. Is it worth it?
Yes.
You know, so
The best sleep ever.
the bottom of the red flag is if it sounds too good to be true, it is.
It is.
Number two, if the surgeons are not, they're not showing you their before and afters, that's a huge red flag. And if their before and afters look sloppy, and they have cords on the ground, and the patient's standing there, and the door's open, okay, well, those sloppy pictures kind of show you what the surgeon, it's sloppy. I have a lot of patients come to see me for consults. They look at my before and after picture books, and wow, these are beautiful. Okay, thank you for the consult. I'm going to go with someone else. And then they come back upset. They said, I thought I was going to look like this. I go, why would you think that? I didn't do your surgery. Those are my results. And everyone's different. So football season's back, right? Everyone's excited. Football's back. Everyone's excited to watch Patrick Mahomes throw the ball. Well, why is Patrick Mahomes paid literally $500 million, first quarterback to get paid that much? Because he's awesome. And there's really not any other quarterback who can really play like him. So people understand that in sports. But for some reason, when it comes to their own surgery, they don't understand. And they're trying to compare Patrick Mahomes or Tom Brady with some high school quarterback who, and do apples and oranges. And that's the reality of surgery. Surgery is a sport. These hands are what make the results. Yes, I have my team, I have everything, but it's all of my training, all of my education, all of my experience, my eyeball, helping you pick the right implants that fit your body, how we suture, how we operate. That's not comparable. And I mean, even me, honestly, I have my old picture book when I did my fellowship at Scottsdale. And I did a year-long fellowship in Scottsdale after I'd already done cardiac and plastics. And my mentor was good. He had a beautiful building like this, 2 ORs. He was very experienced. But I bet you, if you look at my pictures from Scottsdale and you look at my pictures today, you'd be like, wow, what a difference. Well, yeah, I'm 10 years older. I have more experience. But even my mentor was doing his surgery. Mm-hmm. So one of the people has a question. He said, what's the question?
Sometimes the before and afters are very different, and it's probably because they're staged.
Oh, that's true. Maybe you've seen that. The surgeons will show you a before and after picture, and you can tell it's a different person in the after. It's not even the same person. So that's like super fake, super unethical. The other thing, it's unethical to use Photoshop when you're showing patients before and after pictures. That's unethical. So there's a lot of corners that people will try to cut. And people will argue, they'll think my pictures are Photoshopped, and they're not. They're not Photoshopped at all. So, you know, and I'm very strict on how I have my staff take the pictures so we get the good before and afters and not this sloppy results, just like you do with your Botox and filler patients, I'm sure. So that was a good question.
You had mentioned that there are some gynecologists doing plastic surgery. What qualifications should patients look for specifically? Is there a title or a specific qualification that they need to have?
You know, it's really hard. There is a whole group of cosmetic gynecologists, and Dr. Pelosi is a big advocate. He's a big member of the American Academy of Cosmetic Surgery. And the reality is, the easiest way to become a surgeon out of medical school is to go through OBGYN, okay, because they do C-sections. But that's not real surgery, okay? But, so you can't compare that training with the training of a cardiothoracic surgeon. And one of my colleagues is a heart surgeon, and he got tired of doing heart surgery in his 50s, went to a year-long fellowship in cosmetic surgery, and he's a phenomenal cosmetic surgeon. I think the reality is like the person who did your surgery was just an OBGYN. He was from another country, and I guess he has done some lipo in his other country where he was from. And so he was here in the US doing lipo in his clinic and trying to get into breasts. And the bottom line, what patients have to understand is this: Medicare and health insurance is killing doctors. And why do you think you have so many OBGYNs trying to get into cosmetic surgery? Well, because one, they have the patient, right? They took out the baby, they did their C-section. Oh, I don't like this. Well, I can cut it out for you. And they charge super little because they think they're making a lot because insurance is paying them so little to do a C-section. That's a big problem. So I think when patients are really looking to do cosmetic surgery, Laura made a really powerful comment. I don't know if people caught it. She was doing the surgery to make herself feel better about herself, and she ended up feeling worse and mutilated. And that's what we see when we do these botched patients who come from other places. I think ultimately, if it sounds too good to be true, it is. Everything has my dad had the same problem when I was growing up, and he was doing cardiac surgery here in McAllen. He was #1 in the state of Texas with his outcomes. And people, the cardiologists would send him to other heart surgeons, and then the patients would ask, well, why did he die? How come my grandfather did good, but how come he died? Maybe it's because it's not the same surgeon doing the work. I mean, like we said, it's a physical activity.
I think like patients also don't. I think that you don't realize that cosmetic surgery is the full circle from going in, getting marked, going through the surgery, waking up, the care afterwards. You can't just say, oh yeah, I'm gonna take out that fat and then not follow up, because it's a team effort. When the patient goes home, no matter how much you tell them how to take care of themselves, there's a lot of patients that aren't very compliant and follow the rules. So it's good that you have the staff that actually is trained, educated, and trained by him as well on what to look for, what complications to look for, and be like, oh my goodness, we have an issue here. And other places, like he was saying, don't have that. It's the receptionist, and they may just say like, okay, you came in, that'll be X amount of money, now go back home. And people think they're doing okay, and they're really not.
And if they do have a problem, then they'll just send them to the ER and say, I don't know how to fix that, go to the ER, which is a major problem. So there was a question about, tell us more about bad experiences, botched. You know, and I feel bad. You know, I had this one patient, she was a really complicated breast augmentation revision, and I had done her surgery, 5 years ago. And then she came back to my office last year, literally crying. And she looked at me, she goes, please don't get mad at me, Dr. Rodriguez. And I said, why would I get mad at you? And she showed me her stomach, and I go, what did you do? She goes, well, my friend went to this other guy in town, and he said he's a board certified cosmetic surgeon like you, and I liked his prices better, and poor thing, her stomach was just ruined. So I had to redo her tummy tuck, and she's so much happier now. And again, she's like, I'm sorry, I got confused. Because there's a lot of alphabet soup out there. You have the plastic surgeons bashing the cosmetic surgeons. You know, you have gynecologists who didn't even do any training trying to do breasts like you. It's really confusing, I think. And Facebook is out there, and everyone's trying to like entertain. It's kind of stupid if you think about it. My job's not to entertain you. My job's to do good surgery on you. But you have a lot of these people on their Facebook lives and on their Snapchats dancing around in the OR and acting like monkeys. And I'm sorry, this is surgery. That's a red flag right there. And there's a lot of really popular surgeons on social media from Florida to Beverly Hills. If you take the time and really look at their before and after pictures online, it's kind of embarrassing. So maybe they're popular in social media, but look at their results. That's the red flag right there. Are you seeing the surgeon for your consultation? Yes or no? Can you please show me where I do my surgeries, and who is your assistant? Can I please see your before and after pictures to get an idea of what I'm... And they should have multiple before and afters, and they should be able to find someone who looks like you. Like, I have before and after pictures. I have some patients who look like you. I have other patients who look like Dulce, and I can show you, based on my before and afters, this is what I think is realistic for you.
Oh, that's a red flag. They're free consultations, but they really didn't see the surgeon or the doctor. They just saw the secretary, and they just...
Or the MA.
Yeah, or the MA, and they were like, yeah, it was free, but I didn't even see the doctor. That should be a red flag too, I think,
Yeah.
as well.
How often would you say that you have patients coming in to fix botched surgeries that they've gotten elsewhere?
Oh, sadly, it's pretty common. I mean, I am like the botched. And the sad thing is, and you can tell me if I'm wrong, but Rose, she's my patient coordinator, she tells me she goes to parties, and she goes back in the day before COVID and having drinks with her friends, and everyone, oh, you work with that doctor. He's the expensive one, and he's the one who fixes everything. Okay, well, we've talked about the fact that it's really not expensive. It's just what things cost when you do it right. And then secondly, yeah, I guess that people know I'm the guy who fixes things, you know, because they went somewhere else, rolled the dice, tried to get away with the, you know, or they just didn't know. I mean, Laura was a nurse, and she ended up having surgery with this OBGYN who had zero training in breast surgery. And that's the thing, is that we don't cut corners, you know? I was prepared to use an expensive piece of mesh on Laura's breast. I didn't have to, because I was able to do it all under the muscle. But I was prepared, and then Laura was also prepared. If I have to use it, it's going to cost extra. So we just will not cut corners on our surgeries. If I'm doing a tummy tuck and the scar looks ugly, we got a flipper to finish the case, because make the scar look nice. I'm not going to finish the tummy tuck and leave a patient with dog ears, even if it costs me an extra 30 minutes in the OR to do it right.
Can you tell about some more specific patients that you remember coming in for correction?
Oh man, it's one of the worst patients to come in is the redo liposuction patients. You know, one of the problems with bad liposuction, and you see it a lot from Mexico, over lipoed to where the skin looks like a skeleton stuck on the muscle underneath, and you can't fix that. A redo lipo, even with Vaser that I have, can make it better. Hopefully, if the patient can get a tummy tuck, then I can fix the bad lipo, but they have to have enough skin to do a tummy tuck. So that, I'd say, is one of the most challenging redo. Redo breasts, actually, they're hard and they take a long time, but they're fun to do, because you can actually really get usually a really good result doing redo breast surgery. Redo tummy tucks, I've had to do a lot of redo tummy tucks. The scars are so high, they can't even wear pants because their scars are way up here. And fortunately, I did a redo tummy tuck on a man. He had gone with another plastic surgeon here in town. At least he went to a plastic surgeon here in town, but horrible result. He was very unhappy. We redid him 8 months after his first surgery. He's super happy. And I've actually done, that's true, you just reminded me, I've done gluteal implant surgery, which is butt implants. And butt implant surgery is complicated because you have to put the implant inside the muscle. It doesn't go on top of the muscle, and it doesn't go under the muscle. It has to go inside the muscle. And it's a special implant made just for butt implants. This woman had gone to Matamoros, and the surgeon put these breast implants on top of her muscle. She looked ridiculous. Hers was a very difficult redo butt implant case, and we did it, and she did very well. But that's the kind of stuff I'm seeing, you know? Have we gotten any questions from the Facebook Live people?
We've gotten some positive feedback from a patient who's just gotten a breast augmentation, I believe. A breast augmentation, and she said she's very happy with the work that you've done.
Oh, very good. I'm happy for her.
I have another question. What's the worst case scenario that can happen for patients if they go to an unqualified cosmetic surgeon?
Well,
Could die.
they could die, honestly. Like, the cosmetic surgery is not a joke. A liposuction cannula, I should have one here from the OR to show people. It's a weapon. I mean, it's a long cannula, and you can literally stick a lung, stick a liver, stick the intestines. Like Dulce was saying, people come into her ER septic, sick, dying from their cosmetic surgery because they punctured a liver. And so, it's okay. That's the worst case scenario, but there can be other terrible scenarios. Poor Laura suffered. She shared her own personal experience. Her breasts were infected severely. She was very self-conscious. She's lucky she didn't get an infection. She told you were on 3 antibiotics for a month because of how severe her infection was. So
And then it affects my daily living, working, driving. At that time, I had a 2-year-old that I couldn't even pick up or carry or hug or really grab because I was completely open. When I say I did 8 months of wound care, I mean that I couldn't take a normal shower like you do. I had to bend over, wash my hair, and that was painful because my breasts were over the tub. And then I had to wash from my body down for 8 months. That's not normal.
It's horrible.
So cooking, the heat, those type of things would affect me. I couldn't sweat. So it's like your whole, worst case scenario, your whole day is screwed. So people don't realize that. And I unfortunately had to go through that. But, I believe I'm super positive. Everything happens for a reason. And like I said before, I was embarrassed because I should have known better. But thankfully now that it's fixed and I feel 100 and 300, 500% better, it's like I want people to know that there is a solution. And before that, I want them to know, like, don't make the same mistake I did. Don't even go through that. And don't even risk it. Yeah, even if it worked for your friend or something, you're talking about your life. Nobody's going to deal with you.
That's the thing. You people will say, well, my friend looks good and she had surgery with so-and-so. No. Have you seen your friend naked? No, she won't let me see her scars. That tells you right then and there. Because a lot of women can look good in clothes with fajas or whatever and covering up their scars. But patients who are proud of their surgery are more than happy to take off their shirt and show you their scars, who had good surgery. And there's another thing I wanted to talk about, patient safety. These devices are dangerous. Patients can get severely burned if someone doesn't know how to use these devices. And so even though these are devices and Laura's doing it, she's highly trained. And a lot of these devices actually require anesthesia to get the right result. So just because someone has the same device doesn't mean they know what they're doing, much less that you're going to get a good result. So those are important things to think about.
We have a question from a viewer. What type of anesthesia will I receive and who will provide my anesthesia?
That's an excellent question. So I personally believe that surgery should be done under general anesthetic. It is the safest way to do surgery. There is a movement in the world of cosmetic surgeon, pushed primarily by the gynecologists, I will say, in the American Academy of Cosmetic Surgery, trying to push for awake surgeries where they just take a pill and they do tumescent. It doesn't really work very well. And so we do all of our surgeries under a general anesthetic, which is the safest way to do surgery. I mean, if you have heart surgery, it's done under general anesthesia. And then while I'm operating, I use a lot of local anesthesia so that my patients wake up with very little pain. And you heard it here. Not only is it the way that I operate that makes, I'm gentle with the tissues so I don't cause bleeding, and then I do the local anesthesia, and plus the whole time you're asleep, and so you can have a 10-hour surgery and you wake up and you feel like you just had a little nap. Anesthesia is magic, and we have a dedicated, full-time nurse anesthetist who works here with us, and she does all of our big surgeries, and then she also helps Laura provide sedation for some of our more painful lasers. So yes, I personally believe in general anesthesia for my surgical patients, and I have a tremendous team who just does beautiful anesthesia. My patients wake up with no nausea, they're happy. It's a wonderful experience overall.
We have a viewer asking about the recovery for different procedures.
The recoveries?
Yes.
Well, obviously it depends. For a primary 1-hour breast augmentation, those patients, I encourage them to go out for dinner that night, and they can go back to work, literally have surgery on a Friday, back to work on Monday. You talk about a butt implant case, that's a totally different recovery because the incision is so delicate. They need to commit to being at home, laying on their belly for like 6 weeks while that incision heals so it doesn't open up and show off. Laura, for example, had a complicated 5.5-hour breast aug, breast lift redo surgery, and she was back to work on Monday, and I did her surgery on a Wednesday. My patients, my tummy tuck patients, are walking the same day. It's because of how I operate, how I do my anesthesia, how I am with the tissues. So my patients have very good, and a lot of the patients are scared to have their tummy tuck because they saw their friend who went to
Hunched
Mexico
over.
or went somewhere else and couldn't walk for 3 months. And I tell them, don't listen to them. Just don't listen to them because you're having surgery with me. And it's night and day. And I've done a lot of redo tummy tucks, and they're scared for that reason. But then they come up for my surgery and they're like, oh my God, this is great. I should have done this the first time.
We have another question from Facebook. What's the difference between cosmetic surgery and plastic surgery?
It's a very good question. Cosmetic surgery is a subspecialty of plastic surgery. So plastic surgery, when you finish medical school, you go into training. You go into surgical training. General surgery, think gallbladders, appendix, pancreatic cancer. Then you do specialized, you can do liver cancer. Cardiac surgery, heart surgery, chest surgery. Anesthesia, don't do surgery. Gynecology, go deliver babies and do C-sections. And then plastic surgery, which is a 6-year residency now out of medical school. And they basically deal with burns, a lot of trauma, motorcycle accident. Think motorcycle accident, patient comes in with their calf and ankle all mangled, and it has to get reconstructed with ortho and plastic surgery. Think breast cancer removal, breast cancer reconstruction. Within all of plastic surgery, there is cosmetic surgery. And the plastic surgery residents, I can tell you from experience, do not train in cosmetic surgery during their residency. They don't. They are expected to figure out how to do a nice breast augmentation because they've worked with breast implant, breast cancer reconstruction. The problem is all residency training for all medical students who graduate in the United States is paid for through the government at the teaching hospitals. So why would the government pay to train plastic surgeons how to do breast augs, liposuction, fat transfer, butt implants? That's cosmetic surgery. So no plastic surgeon in their residency learns how to do butt implants. They don't. And in addition, when I trained at UCLA, my own professors in plastic surgery told me to my face, I'm not going to teach you how I'm doing this because you're going to be my competition in a couple of years. So think of cosmetic surgery as a subspecialty of plastic surgery, And that's why the Cosmetic Surgery Fellowship exists. And just to give you an idea, there's a very famous plastic surgeon. His name is Dr. Ray. He's Dr. 90210.
Yeah.
And he got too popular for his own good, and the plastic surgeons wouldn't let him sit for the plastic surgery boards, even though he was a good surgeon. So what did he do? He called us and asked if the American Board of Cosmetic Surgery would certify him. He passed our examination, we reviewed his surgical results, and he's now a board certified cosmetic surgeon.
We have a comment from Jacqueline. She said, the nurse that gave me anesthesia made me feel so comfortable and was with me prior and promised me she would be with me the entire way. So that's
very good care. And thank you, Jacqueline, for sharing that. I'm glad you had a good experience. Our team prides itself on trying to make these experiences as pleasant as possible, understanding that it is real surgery.
We've got just a couple more minutes, so if you could touch on breast augmentation illnesses.
Okay, so that's a big debate. That's a lot. That's a big question, Kelsey. One thing I do want to talk about, since we're coming towards the end of the Facebook Live event, is it's your body. When you're deciding to have cosmetic surgery, respect your body. I never once, when I was doing cardiac surgery, did a patient's family ask me, what's the cheapest heart valve that you can put in to my grandmother? No, everyone always wants the best when it comes to heart surgery. I've never heard anyone say, you know, I think I'm going to go to Reynosa for my heart surgery. No, it doesn't happen. But so why don't people take their own bodies seriously? This is serious surgery. So Kelsey's question was about something that's called breast implant illness. And you see I'm doing a lot of quotations. It is not officially recognized as an illness. But we, in the plastic surgery and cosmetic surgery world, do recognize that some women, after receiving silicone breast implants, perceive that the implants might be making them feel sick. And I personally have had a patient who I did a beautiful breast augmentation on, and she loved her implants. But she started kind of feeling sick after a couple of years, and she went and she got her implants taken out, and she said that she felt better. Okay, so that's what breast implant illness is, and there's a ton of different symptoms that go along with it, but the bottom line is, I got implants, now a couple years later I don't feel right, maybe it's the implants that are making me sick, let's take them out.
Which was me.
With your old implants?
With my old implants, I thought, why do I have all this body ache? Why do I not feel good? Why do I have chest pain? And I started researching breast implant.
But you have breast implants now and you feel great.
And now I feel great. So
Okay.
I feel that it was the job that was done. It wasn't
It
the
may have been.
procedure.
But in the world of surgery, I myself personally have been trained in heart surgery. I've put in heart valves. Heart valves, sometimes people know they're pig valves or they're mechanical valves. Never had a heart surgery patient tell me, I think I feel like a pig because I have a pig valve. Never happened. And that valve is touching your blood and circulating in your blood. Whereas a breast implant, once we put it in under the muscle, the body walls it off. The breast implant isn't touching your blood at all. So, you know, it's something that we respect as physicians, and every woman is entitled to, if she feels her breast implants are making her not feel good, certainly they're entitled to have them taken out.
Okay, that's all the time we have for today. Thank you for joining us. I'd like to remind our viewers to fill out the survey that's in the live event discussion. And if that's all that we have for today, then thank you so much.
Thank you.
Thank you.
Thank you, Laura. You did great.